This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
DPC, for me, is freedom for each physician to find their own optimal version of independent health practice. I am Dr. Marga Zarraga of Genera Health Direct, and this is my DPC story.
Dr. Marga Zarraga graduated with a degree in medicine from the University of the Philippines College of Medicine. She took her residency in family medicine at the Brooklyn Hospital Center in New York City, and after living in Illinois and New York, she settled in Massachusetts. She opened up her DPC doors in June of 2019. Welcome, Dr. Zarraga.
Thank you so much for having me.
You started your DPC while also working for a nursing home where you were unfortunately exposed to COVID. And that is a big fear that a lot of us have given the nature of our job during this pandemic, especially if you are in solo practice. You have said to others since your experience to use this pandemic to our advantage and frame it in a way that can make or break you. Tell us how your COVID exposure helped push you forward.
Thank you for starting me off on that note, because that's already the meat of the message that I wanted to say. So to straighten out some facts, like you said, I started my DPC practice in June of 2019 in Massachusetts, and I was still working as a part-time employee as a nursing home doctor, admitting patients from the hospital and taking care of long-term care patients. So I did that side by side to give myself time to build a panel and as well as secure my finances. During the pandemic, the struggle was for a contracted doctor. We have these terms of employment where upon this date, then this is what will happen and so forth. So I had to sort that all out, lawyers and everything, and it was a big mental load, untangling myself from even the part-time employment job. Maybe because I also value relationships a lot, and one of the things that I'm very proud about is I've never left a job position in. I always wanted to leave it in a good manner, which segues right into the pandemic. They were aware that I was leaving in 30 days, vis-a-vis the news of the pandemic was coming up, and PPE shortages, lots of stress on the staff. And also, just tuning back into those days, being ridiculed and, you know, I wouldn't say shamed, but made fun of by some staff members who had no idea what COVID was at the time, because my nurse practitioner and I would come in full garb. When I say full garb, it wasn't actually full garb. It was my scrubs, my winter hat, and my N95, which some people found entertaining, which I particularly really felt sore about that people were making fun of it at the time. And of course, happened on April 1 that I got one phone call to see one person ahead of everybody else. And within a span of an hour, I diagnosed 4 positive COVID cases, which is quite memorable and I would say to an extent traumatizing. And was this after which, with the shortage of PPE, we had to sort out what the next thing to do should be. And we consulted our agency, the one that I was supposed to resign from. And they basically said that I qualified to be quarantined because I came in contact with patients who are positive. So quickly launched into telehealth for a few weeks. The biggest impact on me was I was just preparing financially to be fully on my own with my practice and other stints that I put together. And so basically, I I knew that nothing could happen ideally, but it's just quite unfortunate that the whole mental load of the pandemic came along with it. And at that moment, given this was such a highly anticipated time, there are these key moments that I can't forget where, I take several, I call them clearing breaths. That's what I teach my clients. You take several clearing breaths and you say like, this could go either way. Um, and this absolutely, I absolutely have to drive this in a way that I thrive. I was just surviving was not a question to me. Because I felt like when you make a decision that, um, that this is gonna get done no matter what. Um, and I and what's worked for me, because it's obviously true to my own truth or reality and my passion. I think about my children and I think about my dreams and aspirations for them. And it's very easy to well up in tears when I think about, what the sacrifices my family made, both my in-laws and my own biological parents. Everybody made sacrifices to support me and my husband in migrating to America. And everybody, even my brother, sister-in-law, living apart from family, bridging together childcare, that all kind of like replays in your head at the thought of failing at opening my private practice. Like, this was for my kids. It was this is part of the big dream to get them to like the next level. And that was like my driving truth, and everything else, had to be done and had to be followed. Lot of stress on our marriage, like it was a new way of being. Like, we're used to being employed and having routine checks coming in, scheduled checks rather, pay. But now, like, we have to watch every single thing, and it's uncomfortable. You know how couples have a hard time discussing finances, checking in, what are we spending, when should we spend it. It's not comfortable. But you always have to, you know drill down, and from that spirit be able to communicate. And it wasn't easy, but thankfully, as I said, that, touching on family life and how I pulled myself together, Um, and I mean, there was a plan, so I worked the plan the work the plan. So yeah, that's a lot for a first what? How many minutes have we done?
So
Yeah.
in terms of minutes, you can't put a number to what you just shared. I think that, the quote that I'm going to pull from what you just said, surviving was not a question for me. That is something where you've put into a succinct sentence how a lot of us feel these days when it comes
Yes.
to the unknown of this pandemic, when it comes to protecting ourselves and our families. The idea of we have to survive, we have to make it through this is paramount to how we all act. And that's, you have come from a place where, out of even a portion that was painful when people were making fun of you for wearing PPE and protecting yourself,
Yeah.
you have moved beyond that and have shifted your focus to what truly matters to you and your
Yes.
family. I applaud you for that. It's not an
Thank
easy
you.
experience, what you described, but you have continued to be successful despite that. One of the things that you have become impassioned with is incorporating personal coaching and wellness. Can you tell us about how you incorporate wellness into your practice? Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yes. Thank you for all of that. I first wanted to respond to how you said thriving no matter what, thriving in adversity. Uh, that resonates a lot with me on a daily basis. I attended all these self improvement classes over the span of the last 2 years when I started practice, and one of the recent ones, the speaker quoted like a wealthy gentleman in his anecdotes about having your success independent of whatever else is going around or going on. And that that captured my imagination and represented my motivation that if other people can do this, I want to be able to operate on that vibe where, because I'm centered and because of my belief system that I've wired in, whatever's in my environment, whoever that may be or whatever that may be, pandemic or not, there is a source that you can plug into that will have you operate in a way that is not dependent on anything else but your value system. So that's I wanted to just elaborate more on that point that helps me on a day-to-day basis, which is a nice segue to how did I come from employed position to private practice, direct primary care model, and now exploring wellness in what I call a guidance and coaching practice. So initially, when we launched the direct primary care, when I was part-time direct primary care, part-time employed, I involved, I would say, a board. I created a Genera board of non-physicians, two friends who had strong marketing and business background, advertising, and my husband, who is an expert in operations. So we still are the board of Genera Health Direct. And when people ask me about it, why did you do that? Um, I felt that involving a team would accelerate the journey of Genera. I was also very passionate about creating something that could expand. I didn't see myself operating as a solo for forever. I felt my ideas and passion for really authentic and meaningful healthcare. I wanted to template that and scale it. So I felt this group that we formed, this Genera Health Direct Board, would take us to that. And I can't say how grateful I am to them for sticking it out with me on this journey as the founder. That said, so since we are a team, we part of the Genera experience is a health roadmap, and in the health roadmap, we have a graphic that divides the discussion between proactive medicine and reactive medicine. And I've used that to educate prospective patients about all these other things that can be done to advance your wellness outside of treating the already evident problems of chronic illness or even risk factors such as overweight. I'm talking about things like, what does it really mean to live a high quality life when you're beyond 80 years old? I'm talking about paying attention to sex life and how that plays into longevity. So the most in the blue zones in our planet, where they've seen um, people live beyond 100, those people have follow particular diets that are plant based. They're active all day, and they have a healthy sex life, which is good for both bio, psycho, social, all parts of us. So I began with that, with this graphic, with us giving people the space to talk about things that a rushed 8 minute primary care visit, 8 minutes, because the reported average of a regular primary care visit is 8 minutes. So I was giving them a rich experience in terms of looking 360 on their health. So that was the beginnings of the wellness practice, still within the direct primary care. And I have to say, the blossoming of the wellness practice came, in fact, the major ingredient was the pandemic, because I can't see my offering resonating as strongly without the pandemic as with. So recognizing all the ugly and the beautiful things from this experience of the COVID, this is one of the most beautiful things. So what happened was I started to offer community event, and I called it Wellness and Me with Dr. Marga. And I appealed to friends, my patients, to come and join and explore their interior life through basic wellness practices. I explained it as a session of wellness through breathing and introspection. And it allowed me to connect in a deep way with people without having them reveal too much of themselves to others. Like, it was a safe space. I would call it a safe space where you could come to the water fountain and get a drink. And then I would lead them through breathing exercises, visualization, and one of the heavier things we would tackle is forgiveness. So this is, like, for me, my definition of what the basis of healthy daily wellness practice would look like, and then give them an opportunity to meet me one on one. So with all of the, we're all inside a pressure cooker, and was this my job was to be like the flashlight of the path of the way out of the tunnel. So people started to connect with me one on one, and it gave me, the dream relationship that I've always wanted with patients, where we could go like full spectrum. Some of these patients have their own primary care doctors, and some of them made me their primary care doctor. So I launched my wellness practice under my brand, Marga Zarraga MD, to just do away with the last bit of paperwork when it comes to healthcare. So I have a mix of people in my wellness practice or guidance practice who have a separate agreement where we basically say our relationship is entirely different from that of regular primary care doctor or medical provider. That I am a life and health coach, but I am not functioning as their medical provider. And so with all other things in that clear agreement. So with empowered with that structure, that allowed me, it's like putting fertile soil. I offer one-on-one sessions, full hour. People choose how often they want to see me, and we create roadmaps together. And as again, I'm so gifted that I have such very expressive patients who've shown very clearly how the work that we do together impacts them. And when I say work that we do together, it's because it definitely is work.
You have built a practice that is so unique to yourself, as well as, I'm assuming,
Yes.
the area, given the community support that you've been
Yes.
describing, especially, a health and wellness with Dr. Marga event. That is something that I see a lot of communities lacking these days. I
Yes.
live in
Yes.
rural California where when within the past 3 years, I think we lost our Silver Sneakers program. And that was one of the things that we had
Mhm.
that people were able to partake in. And now with the pandemic, going into a group activity is very rare these days. And so
Yes.
the fact that you have been able to develop a practice that incorporates personal coaching and wellness during these pandemic times, I can easily see how the pandemic is making the drive to join you in that journey even stronger.
Another aspect of wellness that's been very relevant these days is around healthy weight or concerns over weight loss. As I most people know, there's what they call the COVID 15 instead of COVID 19. COVID 15, which is the 15 pounds that is on average been the documented weight gain in 70% of America, which is and yet not surprising because like any addiction, there is um, the tendency to be addicted to foods, sugar, and a lot of people don't realize or kind of are tuned out to the fact that sugar causes inflammation in the body, especially in excess amounts. Of course, anything excessive will always be have a poor effect on our body's balance. So, amidst all of this, I myself have had to come to terms with buckling down on my weight because at the beginning, um, I we quite indulged in enjoying food as a family to cope. There's a lot of emotional eating going on in our house when this all started, and I was already overweight, and I couldn't believe what when I stepped on the scale after about 3 weeks or 4 weeks into COVID. I was 1 pound shy of being obese, and that was like a slap on the face. Not only that, remember, I was actually, psyching myself up to continue to treat COVID patients. Um, and so I was thinking to myself, this is not about vanity. This is not even about cardiovascular health in the next 20 years. This is about now that I will be at higher risk if I allow this weight problem to continue. And it's so what I'm happy to say, fast forward, is with a lot of mental work with my coaches, um, and consistency in my running practice, and really curbing some of these psychological reasons why I indulge in sweets, and have disorganization in planning what I eat because I put work above my own health. So I sorted out and continue to still sort out all of those things. I've developed a program for weight loss, which I like to call Weight Light Living Coach, or Weight Light Living coaching program, where I show innovative and strategic ways around weight loss that involves no dieting and no like tiring exercises. It's all around the things that we already know, except it's approached in the most effective way. So using myself as an example is like the best thing, and is the most effective thing, really. And so I have patients losing weight, maintaining weight, and curbing the trend of weight gain that this pandemic has brought. And it's a way of living, it's a way of thinking, it's a way of wiring your subconscious to really reflect on relationship with food. So that's like the novel thing that I'm shedding a light on um, in the wellness program right now. So looking for people to join that group that will be starting in October 1.
I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. When I hear about DPC docs developing their own unique practices, one of the things that I think about is how do you manage your time, especially knowing that you have a husband, you have 2 boys. How do you work your time so it works out for you to be able to see your patients, take care of the people who you are doing personal coaching and wellness with, and your family?
To address the question on time management, I've actually taken on a very conscious effort with the help of coaches. So I like to share that because it's to reinforce that I practice what I preach. Because people come to me for guidance, I want them to know that people guide me too. And I have one specific person. She's my business coach, Jenny Reyes, and she knew what was important to me, what drives me. So she also knew that I needed somebody to arrange all of these priorities appropriately. So we would go through together through a process where I list all the things that I'm interested in, that inspires me, the opportunities, and then basically rank them not only by one criteria but several. And this centers on the financial gain from these business ventures, um, all the way to what energizes me and what inspires me, what's most aligned with my values. And so then it becomes very clear where I should put my time at this moment. And the whole point of evaluating and reevaluating that just makes for a logical step to acceleration. And that's why the progress has been what it's been. In relation to family, I also have chosen to view time with family and work as block times. So what do I mean by block times? For example, you know, committing the attention to the task or the person at hand, meaning not feeling guilty and splitting my mind between, oh, I'm not with my family. Just focus and do your best at the time meant for the work, and at the time meant to bond with the family, and just be all out 100% into that. And so my husband and I, like for example, we had one of my recent he would call it a meltdown because he thought I was mad at him, but I was actually just frustrated that I missed dinner once because I lost track of time. And so, he I'm again, one of my big blessings is my husband likes to cook. He loves food. He likes to cook. And so he's the one in charge of the logistics of dinner. And I'm the one who has clients after 5. So we made an agreement that I expressed that this was important time for me. So, we worked together to coordinate that more efficiently with this whole work from home deal. Um, in addition to that, I was gonna share like one beautiful habit that my children and I have, which is I call it a hug break. It's really a hug and a kiss. So throughout the day, I stop by their study room, and we get like a real meaningful hug and a kiss to my 13-year-old and my 7-year-old. And it's not like, in passing 2 milliseconds and then off to the next task. It's really, I like to tell my younger son, his name is Rafa, so I say, where's Rafa? And it's because I mean that his eyes should meet mine so that we can connect before I hug him. And so that's always been fun, and it's a real nice break where I feel physically connected to them amidst the melting pot of work and home life in this environment.
That's great. As a mom myself, I just got really I got a warm feeling when you said that about the hug break, because that's one of the things that I enjoy about being home more, is that I get to
Yeah.
spend a lot more time with my son. That's wonderful that even at 7 and 13 that you are making it a point to have your kids know that you are absolutely there for them and that you love them so much.
Yes, yes. And one of my struggles has been to keep my block time with my 13-year-old. We actually decided to take an online speed reading course together. So again, very, very work from home pandemic online, doing it with your kids. So, we have to evolve, and we have to, rather than keep on reacting like this is not what I'm used to. The reality is, and I say this to my patients, the reality is change is always happening, and our subconscious doesn't like change. But we have to take charge of our subconscious and say, you're doing this, I'm the boss, you follow me. Just a wellness bit there.
So I want to shift now to your physical location.
Oh,
When you
yes.
opened your doors, you initially had 2 locations, both in Plymouth and Needham, Massachusetts.
Yes.
And since the pandemic, you have focused on your practice in Needham and closed your doors in Plymouth. Can you tell us about that experience?
Yes, so this is very private practice, real estate question, and it's very pertinent. I signed a lease for what was it? 6 rooms in Plymouth in 2019, and uh the DPC practice recruitment as was slow going at that time. And we it was a huge expense, and um we were not in the green in that situation. So um, the Needham practice came about because there were patients who, drove all the way to Plymouth who would appreciate a closer location. So a chiropractor, my chiropractor, opened his doors to me and uh, basically shared his office for his downtimes. He would have a perfect Wednesday where he wasn't working there. So he charged me a minimal fee. He knew that I was starting out. He knew that it was a bit of a struggle. So that was, I guess my luck. I like to tell people what I'm up to so they know. He didn't know that I opened practice just like that. He actually was part of encouraging me because he himself was in private practice for years. So as his patient, he would share those stories with me. Questions about him changing billers and whatnot. So it was a really nice close relationship with my chiropractor, that when in my time of need, he, you never know what relationship will come through for you. So I was very grateful for him for giving me that second location, because it made so many days of my job easier when it came to a particular subset who took advantage of having that location. So pandemic hit, and no, I took out a business loan to basically make this practice possible for me. And pandemic hit. I didn't tell you this before, but we were actually entertaining converting that 6-room unit to um, a work share space. So an agency was supposed to come up, and I guess what I'm trying to share with you is this spirit of you keep looking for solutions to minimize your overhead. And the pandemic hit, so that conversation was, shelved, and I came clean with the landlord, and essentially they were very sympathetic. And because of the frontliners, you know this big sacrifice of working during this COVID, and they knew that I too was working in the nursing home. I think part of it was really um, understanding the plight of a doctor in solo practice. And the other part of it was they also didn't feel comfortable having the idea of a primary care office where COVID patients could be coming in, because everybody else around me was a business office. So it became a mutual agreement to suspend the lease earlier than it was. And that was a huge blessing for me. So we closed the Plymouth office. And, right now uh, of course, things are changing month to month, but there's really been no demand for live, or it's not enough to sustain taking on a new lease elsewhere. And the few elderly patients who I felt need more TLC, I've done home visits. And again, it's just a small panel, but for me, a relationship is a relationship. So I've said I'd rather than resume in an office, I'd rather do the home visits. But again, these are very specific to my situation because of my various mixed roles that I play. Yeah, so that's one way that I've coped with that. Yeah.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Yeah, it's a very good representation of what is happening in different communities all over the country in terms of patients are afraid of COVID. They're
Yes.
acting different with regards to how they seek medical care. And so that is really so fortunate that your landlord was sympathetic to
Yes.
your situation
Yes.
specifically. And that is just something that, you can't be anything but grateful for when
Yes.
you look back at you were able to continue your practice, not have that overhead, not have that headache of what are you going to do with that space.
Yes.
But I definitely agree in that, as in the mindset of a DPC doctor, you're always trying to cut your losses and still give the best care. So that's great that you've been able to morph your practice into one location in Needham, plus home visits
Yes.
and telemedicine visits on top of the personal wellness.
But
Yeah.
majority of it is really virtual right now.
Sure.
I have to say I did a couple of walking appointments. It was really fun. I found the trail. I just wanted to share. This was a direct primary care patient. um it was suggested by a friend of mine who was an athlete. She says, why not make a walking appointment? So I have nearby, again, very lucky, I'm like 5 minutes away from my home in the next town. There's a nice park that you can walk for 30 minutes with a nice pace. So yeah, we made a cardio event out of meeting each other for the first time live. We both had our masks, and we were social distancing outdoors, so it made for a really interesting primary care appointment. I also want to say that that the how my landlord came through for me um was on a basis and a foundation of trust that we really worked hard to establish um from the get-go. Me and my husband would constantly update and be in touch with the building manager, um what we were doing. They because and they too, reciprocating our effort, they too told us that people, businesses in hardship, usually they're kind of just run and hide, and that's, it's all about integrity and relationship in business. And I'm happy to say that when I received what I gave in this situation, so that worked for me.
I love that that was your experience with your landlord. And I also got a huge kick out of hearing about your walking visits. That's a great idea, especially when people are in these different states of cabin fever,
Yes.
fever these days. Marga, I
Yes.
want to ask you some
Yeah.
rapid fire questions.
Yes.
First question is, do you have any tech or tools that you use and love in your practice?
One of my favorites is Spruce. So that's a secure communication platform where I can communicate anything from simple messages, pictures, files, lab results, direct to my patient's phone through the app of Spruce. It also allows me to schedule messages that promote wellness, or have them stay engaged with me as a primary care doctor. So we time all of we call it a Monday check-in, so 9 a.m., or at least a weekly check-in. We send out messages of different wellness content, anything from hydration to longevity, and exercise. So those are one of the cool things on Spruce. I can also have a chat with my staff specifically about a patient, because there's a team-based window, and there's the patient-based window. So if I basically, so me and my staff have a code. If I type the word response, they have a way of flagging that where they are the ones running after the patient to respond to a particular question, like they went out of state and they need a lab done. I need to know whether they actually went for it so that we could watch for the results. So I love how we have I've set up protocols, like if I type response, you know what to do. Like I don't have to say, please ask the patient to so that means the assistant will read what the conversation is, and then I have type response, and then it's flagged for them too. So there's a way of flagging a task for a staff member, and there's a nice little bullet that says if it's done or not done. I've also have a habit with my staff of typing the letter C, like to confirm that they saw the task, but it's not yet done. So these are just kind of like the things that make things flow really quickly. Yeah.
Jumping from how you use Spruce, do you have any resource or resources that you recommend to others?
Yes. As I said, I work with virtual assistants, and I'm a big fan of guiding other business owners in how to best maximize the relationship with a virtual assistant. I've been networking with a lot of entrepreneurs. So when I find someone who is willing to explore a relationship with a virtual assistant, my husband's agency, Nova North Vista, has a team of virtual assistants who are highly capable professionals. I chose to work with professionals based in the Philippines because of personal relationship, and it's only served me well. We were able to find tools to secure information, and thus be able to create this team of work from home personnel. And I started with one, and I'm happy to say now I have two virtual assistants. And on the personal side, the ones that ended up working with me, they're both moms with kids. And so, that's a bond right there. You always have to find some inspiration. And I'm just very pleased that I can support families right now in the Philippines, at least in this small way, of sustaining my relationship with them. And they have helped me immensely.
And by building that relationship, I would assume it's a long-term relationship for both you and the moms who are your virtual
Mhm.
assistants,
The
which is
Yes, the second one just joined us during the pandemic. Maybe she's only on month 2, and
mhm.
but the first one has worked with me. Like she and I couldn't believe it. It's like we've been working for 2 years together. It's like, whoa. So very happy about that.
What do you tell people who are right at the point of jumping into the DPC world but might need one last push?
You have to plan, but also give a deadline yourself for the planning. You have to start the doing. Um, for me, the last key portions of the plan was to come up with backup savings for the times of a financial gap from waiting for patients to come in. If you have that in place, is one. And second, I would surround yourselves with people who have succeeded in their own individual way of launching their own business, and work off from that vibe and inspiration. In other words, staying in an employed position is not going to get you closer to your goal. And but this is the most important. Um, really understand that your business is a reflection of your own personal growth. I can't say that enough. I could talk about that for 60 minutes. people may not realize that their success in business really truly reflects what's happening internally in their own contemplative life, and the power that comes from that in putting out something that's transformative for others and impacting your own growth is like the the most satisfying feelings that medicine and healthcare has brought to me, and I can't say enough about that.
The idea that you have found what a lot of doctors are finding these days who are making the jump to DPC, where personal growth is tied to your business model, is something that I find a lot of people are using to motivate them every day, because it's something new for doctors, especially who had gone into fee-for-service models versus private
Yes,
practice that was separate from the RVU generating system.
yes, yes.
What you've shared today, which is extremely valuable for people to hear, what is the best way for others to reach out to you?
Thank you so much. Uh, for my guidance practice, I go under my name, Marga Zarraga, MD. That's Marga is M as in Mama, Arga. Zarraga is Z as in Zebra, ARRAGA, that's also my website, margazaragamd.com. Our phone number is 508-591-0655. So that's for my guidance practice. And for my direct primary care practice, that falls under Genera Health Direct, which is Genera is Genera. Health Direct, and our website there is www.generamd.com. GENERAMD.com. Our phone number is 508-591-0655, and people should feel comfortable texting or calling. Goes straight to me and my small team. So very personalized service either way.
Thank you so much, Dr. Zarraga, for joining us today. All the best in continuing to thrive in your DPC. Next week, look forward to hearing from husband and wife team Drs. Jake and Christina Much of Defiant DPC in Williamsburg, Virginia. Until then, this is Marielle Conception. For more information on this episode and much more, please visit mydpcstoried.wixsite.com/mysite. That's mydpcstory.wixsite.com/MYSITE.